We're from the University of Nebraska at Kearney, and we are doing a presentation on home healthcare industry. I'm Morgan Vanderbaum.
I'm Emily Molnuffer.
Patrick Stockwell. Jamie Christensen.
The purpose of this project is to provide an overall analysis of the home healthcare industry. We analyze the history of the industry, the current situation, and the various trends to provide a SWOT analysis. We also evaluated the macro environmental factors along with Porter's 5 forces. We found the functional and business level strategies in the industry to be focused on improving the company's operations by attaining superior efficiency, quality, innovation, and customer responsiveness by a means of cost leadership and differentiation. According to NAICS in 2007, the definition of home health care services is establishments primarily engaged in providing skilled nursing services in the home, along with a range of the following: personal care services, homemaker and companion services, physical therapy, medical social services, medications, medical equipment and supplies, counseling, 24-hour home care, occupation and vocational therapy, dietary and nutritional services, speech therapy, audiology, and high-tech care such as intravenous therapy.
The home healthcare industry provides 4 main services to supply the care that is asked of them. These 4 services are general home visits, respiratory therapy, infusion therapy, and medical equipment rentals. General home visits consist of general nursing care, including limited physical examinations, physical therapy, and personal care such as bathing. Home visits make up 75% of the industry's revenue. Respiratory therapy provides care for patients with a wide range of breathing disorders, including asthma, emphysema, pneumonia, and lung infections, cystic fibrosis, and breathing difficulties due to premature birth. Infusion therapy provides patients with necessary treatment and intravenous medication for their own home. Renting or leasing medical equipment is the last service that home health care provides. If a patient needs a hospital bed, wheelchair, or other durable medical equipment which has been prescribed by a doctor, they can rent or lease these items. Insurance companies help with the cost of renting medical equipment, but will not pay more in rental charges than would be paid if the equipment had been purchased. Home healthcare providers have been called upon more and more recently because of the cost of living in a nursing home has increased. In 2006, the annual cost for a room inside a nursing home was $70,912, which was 2% higher than the previous year. Because of these cost increases, families have switched to in-home health care. Home health care recipients believe that staying at home adds value to the costs associated with the service. Today, there are nearly 9 million people living with an acute illness or long-term health problem. Because the majority of patients will be older, nurses and specialists need to be experienced in elderly care.
A little bit about the industry history. In the mid to late 1880s, home care began. This is when nurses were working from their houses. They would also stay home to take care of the children, so it kind of served 2 purposes. In 1909, the demand for visiting nurses increased. According to Marshall Cavendish, 1,413 nurses were working on behalf of 566 associations. From 1930 to 1950, the demand for health care in the home decreased due to degenerative diseases. In the 1960s, Medicare and Medicaid began reducing the costs passed on to the patient. This increased the demand. And in 1982, according to Marshall Cavendish, National Home Care Association was founded to provide high-quality care hospice and home care patients and to act as the industry's voice. From 2001 to 2004, the healthcare costs rose dramatically. This made it very difficult for those needing home health services to survive because their income wasn't increasing at the same rate. Then in 2007, according to Standard & Poor, the industry had a 10.5% increase in revenue.
The top 3 industry leaders in home health care are Lincare Holdings, Amedisys, and the Vitas division of ChemEd Corporation. Lincare Holdings is by far the largest with a $1.9 billion capitalization. This firm specializes in respiratory care, infusion treatment, and medical equipment for the home use. Lincare Holdings operates in 47 states throughout the U.S. The second largest firm, Amedisys, focuses on hospice care and in-the-home services aspect, which is the largest service division in home health care. The VITAS division of ChemEd specializes in hospice or end-of-life care. These three industry leaders are highly dependent upon Medicare reimbursements, and as a whole, the industry is highly fragmented. In terms of demographics, the home healthcare industry deals mainly with the elderly. As a result, most important demographic information to the industry is the number of people over 65 and the status of their health. According to the U.S. Government Accountability Office, the number of individuals in the U.S. over age 65 is expected to grow by 20 million from 2000 to 2020. In addition, the number of individuals over the age of 85 is expected to nearly double during that same time period. This is a direct result of the aging baby boomer generation. There's a direct relationship between the number of individuals over 65 and the level of government spending on healthcare. In 1994, approximately 1 in 8 Americans was age 65 or older, but by 2030, 1 in 5 Americans will be a senior citizen. From 2010 to 2030, the baby boomer age 65 to 84 will grow an estimated 80%. In terms of healthcare risk factors, there are many trends in the U.S. that will be tough on the healthcare industry as a whole. Despite an increasing awareness of the importance of overall health, risks like smoking and obesity are still leading to chronic conditions like heart disease and diabetes. For example, one study found that obese patients had significantly higher numbers of primary care visits and diagnostic services compared to non-obese patients. This graph shows the trend for baby boomers and the projected elderly U.S. population from 2000.